I'm Dr. Lori Davis, and I am in private practice as a clinical sexologist. My background is in medicine and nursing. I've been a nurse practitioner for over 10 years. And probably about 6, 7 years ago, I began this journey into sexology after meeting women who had terrible pain with sex and other conditions for which they were basically being ignored by the medical establishment. And so I kind of was in the midst of my own journey around sexuality, as we all are on one, right, all the time, and learning a lot. And, one of the big messages that I had sort of taken in was that I knew I wasn't alone through my work, and I knew that I wasn't broken. And I knew that what was going on with me really mattered, right? That was something I had learned. And it was the message that I really wanted to share with other women. So I had this like light bulb moment where I was like, wait a minute, you know, this is actually what I do, and women deserve better. So I just kind of made this 180-degree turn with my career and studied sexual medicine first because I really wanted to be able to bring the very best that Western medicine, and now more of a holistic approach, has to offer to women and anyone who has sexual concerns. And then I also became a certified sex counselor because what I found in my work is that it's really, you need a holistic approach. That, medicine is going to get you so far, but I wanted to offer something that was really like mind, heart, soul, body kind of support so that people could live their way into the sex lives that they really long for.
Oh,
So that's
wow.
my background. Yeah.
Yeah, that's really incredible. There's a few things already that you said that I kind of want to go back to and touch on. First and foremost, I think it's really beautiful that, you saw the need to include mind, body, soul, heart in all of this, because I think we all are getting to the realization that they are all interconnected, and you can't really just treat one thing without having a look at everything, because
Yeah.
everything is at play. And I know here in the West, we don't have as many opportunities to have that holistic approach. So it's really encouraging to see that
Yeah.
some of our practitioners are bringing it in. And you mentioned something that really stood out to me that I thought was interesting, which is that especially when it comes to women's needs, even in the medical world, if it has to do with our sexuality, they're put to the side and ignored.
Yeah.
And what stood out to me about that is that it's very clear that in our society in general, anything that is sexual or intimate in nature is cast aside and shunned. And so to see that it actually trickles down to our medical
Yeah.
practices and needs is really interesting.
I mean, it's frustrating, right? I mean, we deserve better. We just have a history in the sort of Western medical traditions where sex just means protection for, contraception and STI prevention is really all that it's about for us. And the concept that pleasure or like functioning would it all be part of the conversation with your medical provider is just like, it's still on the edges. It's still on the fringes. We made a lot of progress, but um, it's a problem, and it's especially a problem for women. Our pleasure is particularly left out, and one of the big ways that I see that is just in thinking about anatomy, right? So we look at like clitoris anatomy, and it's likely that your primary care provider, your therapist, your nurse practitioner, that they've never seen the whole full anatomy of the clitoris. And it's like simple things like that. Like, how could it be that even our anatomy is invisible? So there's a lot of work to be done, and it's really, really frustrating. It affects everyone to some extent, and I think women, yeah, but we bear a lot of the brunt of that. Yeah.
Why do you think it is that anything that has to do with pleasure, I think that's the key word. I think
That's the word.
that's
Yeah.
the word. It is, it's about the pleasure. Why do you think that we are kind of cast aside or so uncomfortable with it in our society and many
Yeah.
societies around the world, actually?
It's true. When I think about that question, I just think about like this is like pilgrims landing on Plymouth Rock. They came with a very puritanical Christian belief system. And it's not just Christianity, but lots of religious systems have a real sense that you can't trust the body, right? You can't trust pleasure, right? You should follow the dictates of this book or follow the dictates of this priest or whichever religious authority you're following, more than don't trust your body, because pleasure is actually a source of evil. I think that we have a real distrust of pleasure. People have like pleasure resistance is a phrase I really, really like to think about, that people are like unable to accept and receive pleasure. It's a skill that we have to learn, actually, which is just like shocking, because that's what bodies are for. Bodies do pleasure, bodies do pain. I always say bodies do pain, and you do not have to allow pain in, right? Pain comes unbidden to your door and comes right in, but pleasure is something that we have to allow in. We have to receive it, and to invite it into our home of our body. And so we just don't have the skill for doing that. And in fact, we're told not to do that unless we want to buy something, right? We have to have the twin core belief systems of Christianity, religion, and capitalism, right? So you can have pleasure, but it's something you buy, not something you really feel deeply and sort of like live into. So that's my spiel.
I had so many like light bulb moments while you were talking. Here at Live Jasmine, we have thousands of models. I'd say the models in society kind of they get the brunt of the stigma. And
Yeah.
when you were talking, I was wondering, I'm like, is it because in general, these are women usually who have learned to embrace their pleasure and have learned to help others experience pleasure? And is, as a society, are we just kind of like, well, how come you get to do that, or uncomfortable with it and not liking the fact that they basically have taken back their power in that area? What are your thoughts around that?
Yeah, I mean, I think there's so many layers when it comes to why society has such a negative view around sites like Live Jasmine and the kinds of work that workers do there. I love what you're saying about the idea that the women and the other models who work there have given themselves permission,
Right.
right, to experience their own pleasure and to actually work in a way that helps to help other folks have pleasure. I mean, what a beautiful idea, that something like that would be possible. It's unfortunate that it gets layered with so many other stigmas and so much baggage that's all around that. But I think fundamentally there's something going on that's about a wonderful permission giving around pleasure, and also that around intimacy, which is also really hard for us. I think that we all have that sense that women have sacred knowledge,
Yes.
the sacred knowledge that you're talking about around childbirth, right? Sacred knowledge around sex, sacred knowledge around how to love and be present and be in community, and sacred knowledge around intimacy and, psychedelic experiences and the whole nine yards, right? That there was like this way in which we were the repository of that for our community, right? And we've really lost that. And it's so interesting to think about, like, where do we have access to that at all in our community? Where are our red tents? It's an interesting thing. And I don't really think there is a place. And I think that, yeah, it would be beautiful to imagine a world in which we could get back to that kind of thing again, right? It's interesting when I was thinking about this interview and thinking about the online world and intimacy. I mean, honestly, everything about my own work is predicated upon the fact that you can receive and give intimacy and connection at a distance.
Yes.
I see most of my clients online. Most of therapy in the United States, I don't actually know the numbers, but I think a huge percentage of therapy in the United States is happening online. I mean, so this is one of the most fundamental, intimate, deeply connected experiences that we have, I think, is in our kind of this therapeutic counseling-y kind of role. And that entire profession has embraced the idea that can happen online and that it can happen well. I think even like energy workers, you can do Reiki online, you can do sound bowl healing online, you can, somatic experiencing and trauma processing, and this deeply embodied energy kind of practices can be done online. So I think outside of the world of camming, outside of the world of live jasmine, like we are clearly seeing the capacity for the online sphere to be able to hold experiences that we never thought were possible. I mean, I think if you would have said, I'm going to do Reiki on someone in Switzerland, like what, and that's just one example there. And so, yeah, I think that like my work is hugely influenced by being online, and that's huge opportunity for me. And it's an opportunity for the clients I see, because sexologists aren't available usually in most local small communities. And so I'm able to see anyone anywhere, right? It closes the distance in this beautiful way and gives people access to something that they don't have locally. That's a big piece of what we're talking about, whether that's because that's not available, or the person has a niche interest or a niche need, right? And they're able to find community online in a way they never have been able to before. I think about my own life, my personal life, like my friends and I, like what 90% or more of our relationship is conducted on texting. you know Families are held together by Zooms. This idea that we would hold anything like live jasmine or camming as somehow separate or different from that is ridiculous. And we all know that there are benefits to it and there are drawbacks to it. It doesn't mean that in-person experiences are better than online experiences, because there are lots of ways in which online experiences are better than in-person experiences. That there's so many things, right? There's an opportunity for vulnerability often that people really can't access in person that they're able to access online. I mean, just on and on and on. I think they're fundamentally different in person, online, but it's a great experiment we're undertaking, right? This is a grand experiment. What does it mean for humans to relate to each other in this way, long term? And to me, it's like, I would love it to be a opportunity and to like take from it what is good, and also create really great spaces for in-person connection as well. Like, it doesn't have to be an either or. Yeah.
Yeah, you said a few things that I really liked. You mentioned a word, I think it's one of the most powerful words, especially at this time, which is vulnerability. There is
Mm-hmm.
something about, for some reason, this online space that allows us all to feel a little bit safer. And I don't know what that speaks to. Does it speak to our fear of intimacy? It's like, well, it's a little bit safer because you're not here.
Yeah, yeah,
But there is something, whatever, and maybe it's different for different people. But
yeah.
what we, just speaking to that, what we have found in our members, and what I personally have interviewed a lot of members, and what they've told me,
Mm.
that they've felt comfortable telling the models their deepest, darkest secrets that they haven't told their spouse or their friends or whatever. And what I sense is that part of it is because the model is obviously removed from their life and
Right.
not biased. And really, what it comes down to is that there are these components that you find with therapy. And,
Exactly. Yeah.
you
Yeah. I'm
know,
saying this is these are not two distinct things.
and vulnerability, I think, with Brene Brown's work, she kind of really taught us all, like, hey, we
Mhm.
need this. It's crucial.
Yeah.
Now we're learning that we do need these safe places to feel vulnerable. And I also really liked how you kind of said, like, we're the pioneers of this experiment, where it's like, what are the long-term effects of this? We don't know, but people
Mhm.
50 years from now are going to look back and see what we were doing and decide if it
Yeah.
was good or not.
Yeah. And I sort of like, it's sort of just taking the time for each individual member, right? Each individual model, all of us really, to take the time and space to pause a little bit with all this stuff. It is a grand experiment. And so instead of just blindly falling into the grand experiment, you're paying attention. What of my needs are getting met here? What other needs do I have? How do I go about meeting those needs as well? And same thing with in-person experiences. I think you need to bring the same sense of like the sacred pause, I call it, and like this sense of like bringing a lot of mindfulness to these experiences. That's what I would hope for. I mean, I don't think that's what necessarily folks are going to do, but that would be my hope, is that we don't try to like uh, independently assess, like, this is what's going on inside there, that each individual gets an opportunity to decide that for themselves,
Absolutely. Yeah, I really like,
encourage that, yeah, yeah.
yeah, I really, really like that. I'm curious, in your practice, what are some common issues that you see in
Mhm.
patients, maybe some recurrent problems?
Yeah. Probably the number one thing I see in my practice is what we call mismatched desire, right? Usually, one partner wants to do it and the other partner doesn't want to do it. That's probably the most common thing that I see in my practice. And it just makes sense because, of course, sometimes you're going to want to do it and I don't. But then we get stuck in certain cycles of relating to each other out of that space. And there's lots of layers we could talk about there. But that's the main thing I see. I see a lot of pain with sex. Women having trouble like learning how to orgasm, which by the way is a beautiful thing to explore online. There's some beautiful online courses, and OMGS is a beautiful resource for women looking for orgasm support. So for men, I see erectile problems, performance anxieties, premature ejaculation, delayed ejaculation. Um, I think like fetishes, like things where people are interested in things that are very hard to express to their partner, or their partner has said they don't like that, like just trying to find the fit between the two people, I think is how you could summarize a lot of that. And sometimes there's not a great fit. And I think also people I see like individual men who long for connection, who just have a really hard time finding a partner, you know?
Yeah,
Yeah.
a lot of you, especially with what you just said in the latter, that people who have a hard time finding connection, or people who have a fantasy or a fetish that is maybe uncommon, and so they don't have a partner, they haven't found a partner comfortable with it. I think a
Mm-hmm.
lot of those people end up on sites like Live Jasmine because they're able
Mm-hmm.
to get some of those needs met where they haven't.
100%. And it's not even about unusual sexual needs. It's just in the person's own life, where their own perspective on what's unusual. I see lots of folks who don't have really unusual things that they want, but it's just very hard for them to ask for it.
Wow.
And or it's hard for their partner to give that. Just all of the layers of shame and stigma we have around sex can make what is really something that I think from the outside a lot of people would say is pretty vanilla. There's something simple and like just a sort of standard part of sexuality, or even just intimacy within sexuality, just is not available to them. And I think people really suffer when they don't get those needs met. That's what I see. That's literally what I see.
I'm curious, how many sexual issues or forms of sexual dysfunction come from shame and guilt? Just curious.
uh, I would say 100. That's a good question. I'm going to vote for 100%. It's a layer. It's a layer, and it's probably one of the biggest layers. Yeah. And I think it's just, I think about sexuality and I think about this, it's this really special place where we have an opportunity to be seen in our deepest longing and desire, right? And to be really vulnerable to what we actually really want in the moment, and to be seen by that in another person and loved for it and accepted for it and said, yeah, let's do that, is just so deeply, deeply healing. It's sort of like the gaze of the mother to the child, where it's this unconditional love that's shared in those moments where I see you, I see what you want, I see what you need, and here, and to be able to share that so tenderly. And I mean, on the surface, it can look like wild and naughty and goodness knows what, but the core of it to me is about us being seen in our most vulnerable place and being accepted. I think that transforms people, that transforms people's lives. And it starts to erase that shame and stigma, you know?
Yeah, the way you worded that was just perfect. I think it hit the head on the nail.
Mm-hmm.
Because this is kind of I've wanted to get to the core of the fact that people are not, in my opinion, and maybe correct me if I'm wrong, but I don't think people are just like these wild, horny, naughty things, and that's it, stops there.
Yeah, just
Like,
because,
yeah, just
Just how wild can I be, you know?
Yeah. Yeah. Just let me get nasty. I think
Mhm.
you brought it to a deeper place is that they're actually somehow trying to be seen or understood or like
Yeah.
touch something that's deeper in them that
Yes,
they feel this
100%.
touch. And that's what it like, because I've been thinking and wondering, I'm like, I can see from the interviews I've done with models and members, yes, there can be sexuality, but it's connected to something deeper. What is it? And I think you just were able to put it into words, which is
Yeah. Yeah.
that thing is
It's
connected.
being seen in our most vulnerable. It's such a scary thing, to open up and say, this, you know, this, because we all feel bad about what that is, right? That's the idea. We can barely look at it ourselves. And if we can manifest that and let it come out of our throat and here we present it to another and they say, okay,
Right.
you're it's the same message that I said at the beginning. You are not alone. You are not broken. Like what you want matters, right? And then it just creates this like deep healing. It's deep healing that we all need. That's the erotic moment. Whatever the content is, I think is just whatever.
I see too now why, like, you know, this industry is the camming industry is billion dollar, multi-billion dollar
Mm-hmm.
industry.
Mm-hmm.
I can see now why people will spend so much money on it because I think they're feeling at the core, even when it is something super explicit and sexual, I think
Yeah.
like, oh, even this part of me can be accepted.
Even this part of me, even
Yeah.
this part of me is sort of, you get this little vibration of unconditional acceptance, and it's in the language of love. I know that's not exactly it, but it's in that language that's what's being activated in us of like being seen. We're not alone. I'm
Yeah.
okay. I'm not gross. I'm not disgusting.
Right.
Yeah. And we
Yeah.
need to receive that message frequently.
Yeah.
One time won't do. So that's why we have a billion-dollar
Yeah,
industry.
exactly. Exactly. We need to make sure, am I
You're like,
still
really?
interested?
I mean, this was the worst part of me. Are you sure? You know?
Yeah,
And
because
even when you're talking about the intimacy where someone wants to share about their day, I mean, I bet you in the same way they feel like that kind of stuff they're not sharing with their friend or their wife or their so and so and so and so because there's that same kind of feeling, you know, of being seen. It's sort of like the model is bearing witness.
yeah. And feeling seen and heard and accepted, especially, I think those are the attributes of love. You know what I mean? I think those
Yeah.
people,
Yeah.
and
That is what love is, right? Seen, true. Yeah. Seen, held, accepted. It's sort of like getting that beautiful, that phrase, like, don't yuck my yum, where it's like you have your yum, and the person on the other side doesn't say, ooh, yuck. They say,
right.
yum, and
Yeah.
that's just like this resonance, this yum resonance, like that's just cool stuff. It's cool stuff.
Very powerful. It's
Yeah.
fascinating. Yeah. It's interesting because I feel like there are two worlds. There's the world of people who understand these things and are
Mhm.
accepting and
Yeah.
nourishing, loving to another human being. And then there is the world of on the outside, it's like societal norms and pressures, and you just kind of
Hmm.
judging people because everyone else is, or whatever the case is. How do we start breaking away from that and
Yeah.
coming together with both sides?
Right. Right. I mean, I think it's a tall order, right? These are deeply held beliefs across wide swaths of people for whom this video will never reach them. My hope is that I kind of this idea that like good sex can change the world. So I probably don't see a lot of conservative folks, but I do. I mean, I see that conservative folks have issues with sex just like liberal folks do. And when that happens, they're reaching out for support. And it's just my message is like that if we can heal what's going on in our own individual bedrooms, that's where it starts for me. You heal what's going on in your own individual bedroom, you really open up, you get vulnerable there, you're present there. That's what radiates out. It's like a light that radiates out from our most sacred, like vulnerable place. the person that we love, right? We heal that and that radiates out. That changes the world, right? And for those who have had a taste of that, right, and who kind of had that healing in their own bedroom, they got to speak up. They have to be, like acolytes for the for sexuality. They have to, speak up about the power that sex has had in their own lives to heal and to, just like spread the good word, basically. It's long-term work, but I think the fact that we are so cut off from ourselves sexually is connected to how we're disconnected from nature, of how we arrange our societies, of da 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 da. Like, to me, I mean, I'm a sexologist, right? So I put sex at the core, and I think the fact that we're cut off from that is a good root reason of why we're cut off in so many other parts of our lives and in our society. So I think we turn towards sex, we heal sex, we start with ourselves. And when we learn it, then we got to tell everybody else. Like, that's what I'm doing. That's what the models on Live Jasmine, And so, I mean, I'm sure they have many motivations for their own lives, of where they're at and why they're there and all that kind of stuff. But that's possible.
Absolutely. Yeah. They, many of them that I've talked to have really taken back their power in this place.
Yeah.
They are powerful. They're like, don't care. This doesn't affect me. They feel fulfilled in their work because they know very well that they're giving that.
They feel what they're doing. They feel what's happening between them and the client. I think
Yes.
it's interesting. I've talked a lot about, sort of more of like a religious or conservative, like, dogmas and core beliefs that keep us from our sexuality. But I think for women, another place where I see the stigma is from more of a, like, woke liberal mindset that says, women, if you're on a camming site, you are, you're sexualized and you're objectified. And so, this isn't your true sexuality. This is all conditioned by the male gaze. And so it's not authentic to you, you poor thing, you know, right? The fact that you have to dress this way or sit this way or present yourself this way is a tragedy. And let me come save you from this horrible fate, And those, that portion of society that feels that way is almost more frustrating to me, because I think in the name of trying to support women, you're actually really disempowering them and taking away their freedom. All sex is conditioned. All sex is conditioned. Sex is not a natural act. We live in a culture that is like, we're bathed in the messages of our culture from the minute we come out of the womb, and that affects everything about how all of us present sexually, live sexually, actually are sexual in our bedrooms. And so I just didn't want to, like, just bash the more conservative wing of the folks who have a problem with things like Live Jasmine. I really wanted to point out that, like, in our effort to take care of women, we shouldn't disempower them and take away their freedom to live into what's their true authentic sexuality.
Right. Yeah. I think that's really a good point. I think it's important to remember that no one has the authority or should think that they have the authority to say what is empowering or right for an individual. Let that individual make the choice. If you really want to empower them, you will empower them with their freedom of choice. And what I can say is the models that I've talked to, they do this because they love this, because at some point they've made enough money that they can either not work anymore or do something else. And some models, I talked to many models where they're like, yeah, I left for 6 months, I left for a year, but I missed it because it was so fulfilling about these interactions with the members. They are fully aware that what they're doing is deeply healing, and some of them will tell me, yeah, I think I might become like a licensed therapist. I want to go to
exactly.
Well,
They would probably make excellent ones.
Yeah,
I
of
think
course.
100%. They have tons of experience. I mean, the idea that I really respect, licensure and certification. I have tons of it myself, but the idea that we somehow think that this capacity to be with others, to witness, to accept, to offer what is being exchanged here is somehow only in the purview of someone who has a certain degree or letters after their name is just ridiculous. That's just another form of disempowering people. Yeah.
Oh, absolutely. Yeah, that's really,
That'd be a good live Jasmine scholarship fund.
yeah, right? That's a great idea.
Or like you could have, it's like, oh, you want to do therapy? Let's talk about it. Like this is, like offer trainings and stuff. I think that's just super fun,
Yeah.
you
Yeah,
know? Yeah.
we actually do have a program where we have models that have been specifically trained to deal with soldiers that have PTSD because so many
Ah,
of them
yes.
are,
Yeah.
are all a lot of them are on the site and they're coping in this way. Again, they don't many men in general are
Yeah.
a little bit more uncomfortable with therapy, traditional, and
Yeah.
so you have models that are trained to
I
understand
love
they're
that.
someone with PTSD.
I think expand that whole side. I think that's just so fascinating and empowering, really like what went, yeah, empowering that and sort of, yeah, that's beautiful.
Right? Yeah. Yeah.
Yeah.
Well, thank you so much for your time today. It's been an incredible interview. One of my favorites.
Okay, fun. This was super fun. I've really enjoyed talking to you. It's fun to think deeply about things like this. Such a beautiful opportunity. And I'm glad you guys are just involving people. Let's talk about this,
Yes.
right? Let's be honest and talk about what this stuff is like. And there's so many different perspectives on that. It's a beautiful thing.